I've already discussed what is diabetes, but it's very important for us to understand why we need to treat diabetes. Diabetes is complications leads to different organ damage. That's why we treat diabetes. We don't treat diabetes just because his blood sugar is 300, 400. Because some of the patients may have symptoms, some may not have symptoms. So it's very important to understand that we treat diabetes mainly because it affects eye disease, it affects the blood vessels, because when it affects the blood vessels, it can affect stroke and heart attack. Similarly, it can also affect the microvascular of the kidneys and causing kidney failure. It can have erection difficulties and nerves getting affected. So we treat diabetes not just because of blood sugars, and it's because it affects different organs. And it's very important for us to make sure we continuously assess this function so that we can prevent the diabetes. Most people with diabetes can have different complications, and it's just not the blood sugar which contributes towards stroke and heart attack. It's very important for us to control the blood pressure, control your weight, doing regular exercise, control your cholesterol and using statin therapy and aspirin therapy, and stopping smoking. Certain factors which are not reversible, like males have usually more risk of having heart disease, usually till the age of 50, and males and females have almost similar heart attack after around 50. But and the family history has also contributed to diabetes to risk of heart disease. So some factors are reversible and some factors are treatable. So it's very important to prevent the risk of blockages to the arteries, and that's why we treat diabetes. So most patients with diabetes have risk of heart disease and heart attacks, and that's why it's very important to treat diabetes and its complications. Besides that, doing the routine test to make sure we pick up early so that we can manage your diabetes, not simply blood sugars, but your blood pressure, your cholesterol. Use certain medications to protect your heart and kidneys like ramipril or telmisartan type medication, and make sure we do routine tests including the nerve conduction test, the treadmill test, and sometimes carotid Doppler. So diabetes is just spectrum of disorders which can affect different organs. It's important to do certain tests and manage accordingly, not simply just the blood sugars.